Molecular markers, also known as biomarkers, are molecules found in tissues, blood, or other body fluids that can provide information about normal or abnormal processes occurring in the body. In cancer, molecular markers are critical for diagnosis, prognosis, monitoring, and treatment. These markers can be DNA, RNA, proteins, or metabolites that are associated with specific types of cancer or the biological behavior of the tumor. Types of molecular markers in cancer. 1. Diagnostic markers. These are used to identify the presence of cancer. They help differentiate between benign and malignant tumors and identify the cancer type. Examples: prostate specific antigen, PSA, used in prostate cancer; alpha fetoprotein, AFP, used for liver and testicular cancers; CA1125, used for ovarian cancer. 2. Prognostic markers. These markers provide information about the likely course of the disease, including aggressiveness, likelihood of recurrence, or survival rates. Examples: HER2/neu indicates a poor prognosis in breast cancer if overexpressed; BCL2 associated with the inhibition of apoptosis in various cancers. 3. Predictive markers. Predictive markers are used to predict the response to a specific therapy, aiding in personalized treatment. Examples: EGFR mutations predict response to tyrosine kinase inhibitors in non-small cell lung cancer, NSCLC. KRAS mutations indicate resistance to EGFR inhibitors in colorectal cancer. 4. Therapeutic markers. These guide the choice of treatment and monitor its effectiveness. They are often the targets of therapies. Examples: PDL1 expression, used to determine eligibility for immune checkpoint inhibitors. BRCA1 BRCA2 mutations guide the use of PARP inhibitors in breast and ovarian cancer. 5. Monitoring markers. These are used to monitor disease progression or recurrence and assess response to therapy. Examples: CEA, carcinoembryonic antigen, used to monitor colorectal and other cancers; CA19-9 monitors pancreatic cancer. Categories based on molecular biology. 1. Genetic markers. Mutations, amplifications, deletions, or translocations in DNA can serve as cancer biomarkers. Examples: TP53 mutations, common across various cancers; Philadelphia chromosome, BCR-ABL fusion, found in chronic myelogenous leukemia, CML. 2. Epigenetic markers. Alterations in DNA methylation, histone modifications, or microRNA expression. Examples: MGMT promoter methylation predicts response to alkylating agents in glioblastoma; DNA methylation of SEPT9, used in colorectal cancer screening. 3. Proteomic markers. Proteins or their post-translational modifications identified in tumors or body fluids. Examples: VEF, associated with angiogenesis in tumors; cyclin D1, linked to cell cycle regulation in cancers like breast cancer. 4. Transcriptomic markers. RNA-based markers, such as mRNA, ELNS RNA, or microRNA. Examples: ERBB2 mRNA, elevated in HER2-positive breast cancer; microRNA 21, overexpressed in many cancers. Techniques for detection of molecular markers. 1. Genomic techniques, polymerase chain reaction, PCR, next-generation sequencing, NGS, comparative genomic hybridization, CGH. 2. Epigenetic techniques, bisulfite sequencing, chromatin immunoprecipitation, CHIP. 3. Proteomic techniques, enzyme-linked immunosorbent assay, ESA, mass spectrometry. 4. Immunohistochemistry, IHC, commonly used to detect protein expression in tissues. 5. Liquid biopsy, non-invasive method to detect circulating tumor DNA, ctDNA, exosomes, or circulating tumor cells, CTCs, in blood. Applications in cancer management. 1. Personalized medicine. Molecular markers enable tailoring treatments based on the individual's tumor profile. 2. Early detection and screening. Identifying markers specific to early-stage cancer can improve outcomes. 3. Drug development. Biomarkers are critical in developing targeted therapies. 4. Monitoring disease. Dynamic changes in biomarkers help in assessing treatment response and early detection of relapse. Challenges and future directions. 1. Heterogeneity. Tumor heterogeneity complicates the identification of universal biomarkers. 2. Standardization. Lack of standardized protocols can lead to inconsistent results. 3. Integration with AI. Advances in artificial intelligence and machine learning can enhance biomarker discovery and interpretation. 4. New frontiers. Integration of multi-omics approaches, genomics, proteomics, metabolomics, promises to discover novel markers with higher specificity and sensitivity. Molecular markers hold immense potential in revolutionizing cancer care, making it more precise and effective.